When someone's on the floor with a back spasm, you will find that you eventually reach the point where you need to get them off the floor to take them to the bathroom or to a bed or to the doctor's surgery. This can be quite a difficult situation for people because any movement is absolute agony and the muscles lock and almost prevent that movement. So I would just like to very quickly show you the best way I've found to help someone get up with the least pain possible. So let's start in the lying position. So by now you will have got your friend into a comfortable position on the floor. Now the big mistake that people make in trying to get up off the floor is in activating the back muscles to try and get them up. So they might roll into this position and try and come up like this, in which case you're activating all your back muscles, or they might do it from the side, or all of these movements are just, you'll get there eventually, but it will be very painfully. So the best way I've found is from your side lying position, which most people tend to begin in, is you roll onto your front. What you want is for your arm muscles to be doing all of the work and your back muscles to be completely relaxed. So the minute you roll over here and push up here, you make your biceps do all the work, and you move very slowly. Just walk your hands towards your body and move up here, and eventually just push yourself up. Very, very slowly is the key into the kneeling position. Walk your hands gently towards you and you will find that you'll come up into a sitting position. I'm going to show you now how to get into the next stage of the standing position. So I'm just going to demonstrate how you might help your friend get up off the floor and into a standing position in order to get to the bathroom. So Sarah, if you just want to copy with the movements, so you just turn your body to the floor and put all your weight down through the arms. And she's going to do baby movements, just walking her hands round till she comes into a kneeling position. Just drop the hips back. Now do bear in mind that that can take up to 10, if not 15 minutes, depending on how severe the spasm is that you're dealing with. So don't be afraid if that takes a very, very long time. Now, let's just bring in my little prop. The next thing we're going to need to do is take Sarah into a standing position. Now this can take a very long time, and done incorrectly could result in her collapsing onto the floor again, and we don't want to do that. We really want to avoid that and just get her up. So the key is to go very, very slowly and to remember that you're avoiding the back muscles doing any work at all. You really need to get the legs doing the work and you need to get the arms doing the work. So I've just positioned a very hard chair on the left of Sarah. So I'm going to ask Sarah, just place your hand on that chair. Now Sarah's going to put all her weight into that chair and also into me. So if you're going to help someone get off the floor, do be aware that at any time they could drop and they could put a large amount of their weight through you. So you need to be ready and prepared for that. So make sure that your own abdominal muscles are contracted, your back muscles are contracted, and you're really ready to take their weight or help them very elegantly drop to the floor if they need to. Okay, so Sarah's just going to put all her weight through the chair and through me, and then just bring one foot forward. That's it, and then gently come up into standing position. Bear in mind that can also take a long time. It could take up to 5 minutes even. Now, once you're in this position, to get walking to the bathroom, again, you need to encourage your friend to relax their back muscles. So I would literally talk and say, make sure you relax your back. Don't use any of your back muscles. Put your weight through me, and you should have another friend there as well. Contract your own abdominals, protect yourself. Okay, and the key is just to do little movements, little steps. So baby steps, Sarah. Just shuffle forward. All the time, just relaxing the back, just taking your time and a little bit more. That's it. There we go. So eventually, by hook or by crook, you will arrive at the bathroom or the bed or wherever you're trying to get your friend. Now, getting to a sitting position onto the toilet can also be quite a tricky situation because you do need to activate the back muscles in order to sit down. So it is possible to do it without using your back muscles. I just bring the chair into position. So here's Sarah. So I'm basically just going to ask Sarah to put her weight through me, and hopefully you'll have maybe a shelf or something that they can put the hand through. So just put your weight through me and literally just drop to the floor, relaxing your muscles, using your leg muscles and me. It's a big job helping someone, and you do have to take a lot of weight, and the key is to do it very slowly so that it doesn't hurt you yourself. Similarly, when they need to get up from the toilet, they may need to again put all their weight through you. That's it, nice and slow. Like I said, if there's 2 people, it's much better. 1 person either side is much less effort for each person. So there you go, that's my advice for how to get someone from the floor into a standing position and to the bathroom. There will be lots of ways possible, but that is the way I find works best for me. If you would like more information on preventing a spasm, managing a spasm, exercises to prevent a spasm and resolve a spasm, first aid tips for dealing with back spasms, go to my website, sootheclinic.com.